talking.
Throughout her pregnancy with baby Poppy, Mum Gemma had many questions and choices to make. One that she did linger over was whether or not to have the Covid vaccine.
My midwife told me when I first got a check in January that it wasn't advised to get it. I went back about 4 weeks later and she said actually the advice has changed, it's safe, they've done some studies and it's now recommended to get it. At the very beginning I actually was leaning more towards not getting it. But I'm so glad I got it now because, I mean, everything was fine with my pregnancy and her. And then when she came out, and then she's probably got some sort of antibodies against it, I'd imagine now. So, yeah.
It's a delicate issue with mixed opinions.
I've had my 2 vaccines just now. I'm waiting until I've had the baby to have my booster, only because I'm not really 100% on getting it. It's just the not knowing of maybe how it would react or how I would react to it. Because the last 2 that I got, I was quite poorly with it.
My first vaccine, I was probably about 24 weeks pregnant when I got it, and I guess my decision is a little bit different because I'm a healthcare worker. So my risk benefit was a bit more skewed towards getting the vaccine because I was working in COVID environments in the hospital.
One of the first national studies on pregnancy and Covid-19 from the University of Edinburgh found women who contract the virus towards the end of their pregnancy are more vulnerable to birth-related complications. 98% of pregnant women admitted to ICU with Covid-19 were unvaccinated, and only 32% of pregnant women who gave birth in October last year were fully vaccinated.
Women who are pregnant are more likely to have severe complications from Covid-19, so more likely to need hospital admission, more likely than somebody who's not pregnant to need intensive care unit admission. And very sadly, what we're seeing again in our study is that towards the end of pregnancy there are severe complications for the baby. But we now have consistent and clear evidence that vaccination is the most effective way to protect pregnant women and their babies and can be given at any time in pregnancy.
With the Omicron variant still circulating widely, efforts are ramping up to get more expectant mums vaccinated and help protect 2 lives instead of 1.
Well, Laura joins us now in the studio. So, Laura, what have you been hearing from expectant mums?
Well, I've been speaking to mums-to-be and new mums all day today, and one of them that you heard in my report there was a doctor. She was telling me that at the minute their ICU department is filling up with unvaccinated pregnant women, so clearly a big concern.
I suppose when pregnant, some of us are concerned about taking any medication at best.
Yeah, you're absolutely right. And I think part of the issue is that there's maybe just sometimes not enough research on pregnant women, and some women don't want to take part in studies if they're carrying a child. So you can understand how anxious a thought of a new vaccine might make some women. But I think there is still quite a lot of misinformation out there, and ultimately all mums want to do is what's best for their baby. But the authors of this report today are saying, look, here it is, here's the proof that vaccines are the best tool to protect you and your baby. And one important final point to make is that this study looked at data up to October last year, so before Omicron hit. The authors are very worried that the most recent up-to-date stats could be far, far higher.
All right, Laura, a very sensitive issue. Thanks very much for joining us.